Okay, guys, hello. Hi. It is Tuesday night. We are on a special night, and so we have a surprise. We are here. Normally, our Wednesday nights have been moved to Tuesday nights just for this week, and we are back with my baby experts. And hello, let's wait for everyone to join us. Yes, we are live here. I can see the stream. Go ahead, put it down. Thank you. Thank you. What? We're good. Okay. Awesome. So we're going to just give it a minute and let everybody jump on. It looks like it's frozen. Oh, are we frozen? I think we're frozen, Joe. I can't tell. Hey, Joe. Hold on a second. No, we're good. Okay. So everybody's jumping in. Hey, guys. Yes, I see you. Now I see you. Okay. A little bit of a rocky start there, but everybody's jumping on. Okay, so welcome to Tuesday Night, my baby experts. I am Shari Criso, and I am the host, and I am so happy to see all of you again. And we are going to have another terrific episode. I have a great show for you. This is a topic that we actually have not covered ever. In all these years that we've been doing the My Baby Experts show, I was actually quite surprised when I thought about it, and I thought even the most basic aspect of what we're going to talk about tonight, we have not covered. So I'm very happy to be doing this, especially with my special guest who is sitting right next to me and I'm about to introduce. But as we're jumping on, for everyone who is new to the show, if this is your first time, I want you to say hello, let us know that you're new, and let us welcome you properly as we always do when we have new people, because we love to see you here, okay? Tonight we are talking about chiropractic care for you and for your children and for your whole family, for your pregnancy, getting ready for your birth, and for your baby after the birth as they transition into the world, into life, and coming through the birth process. Such an important topic that so many people, I'm surprised, are not aware of, that this is an amazing type of care that is available to you and to your family. I personally have done this myself for many, many years. And sitting next to me, I have a very, very special friend and guest. This is Dr. Roger Sahoury, and he is an amazing, very well-known. Some of you might have seen him before. He has been featured on many, many TV stations, ABC, NBC, CBS, all the major networks. He was featured in Forbes magazine. He's a best-selling author, and he's also a chiropractor who takes care of patients every single day in his center here in New Jersey, or near my house at the Above and Beyond Wellness Center, which I have personally been to, and so has Joe. And, I'm just so excited to have you here with us, Roger. And Roger was also my student, taking my classes, and he's also expecting his third baby with his beautiful wife, Christina. So welcome, Roger. Thank you for being with us.
Thank you for having me, Shari. It's a pleasure.
Oh, very excited to have you. Everybody's jumping in. They're telling us they're new. You guys are due. Okay, so let's hear it. If you are pregnant, if you already had your baby, if you've used chiropractic care, or if you've not, I'd like to hear, where are you guys from? What have you done with chiropractic care, and how are you thinking how this might work for you? Because we're going to talk a lot about that tonight. Roger, I want you to just talk a little bit about, how long you've been doing this, and I know you've worked with thousands of moms and babies,
Yep.
and tell us a little bit about that.
All right. So I have been in practice nearly 15 years. So it's been a beautiful journey,
Yeah.
and I've been working with thousands and thousands and thousands of families. Right. And it's about the entire family. Right. So mommy, daddy, children, all the siblings. And it's just such an honor to have families entrust in myself and my entire team. So yeah, we've just been seeing so many different miracles, so to say, as people would say, right? But we've seen the impossible become possible. We've seen children who, have had challenges, overcome them, like kids who couldn't speak, who were speaking, kids who have been experiencing different types of ailments, overcoming them, and more importantly, the ones who were running well, staying running well, right? So it's about keeping the entire family running really healthy and well. And out of our 8,200 square foot center in Paramus, New Jersey,
Yep.
we are, just today alone, I've seen over 100 people.
Wow.
And
Amazing.
Yeah, over 100 people. And as far as moms, I mean, I probably saw 40 moms and 25 children today. And
Awesome.
yeah,
Awesome.
so it was
Awesome.
great.
I want everyone to also know before we get started about our amazing prize. And it was such a perfect show for our prize tonight because tonight's prize and our partner, and I see Laura in the chat room. Laura's in the chat room. Laura is the owner and inventor of the Back Buddy. And this is the Back Buddy here. And this is our prize tonight. We're going to be giving away one of the Back Buddies. And what's so perfect about this is that the Back Buddy was actually designed and invented by Laura, who is a nursing mom of twins, and her husband, who is a chiropractor. So this was really designed with the best support in mind for your body, for when you're nursing, when you're pregnant. I can't even tell. You guys know that every single time I do the show, I sit here with one behind me, okay? Because it is the most comfortable thing to sit against when you're sitting on a sofa. And when you're breastfeeding, you want to make sure that you're getting that full support. So you're supporting your back. You got your lower back, the lumbar support on this. It's sort of hugging your body and holding you upright and taking that pressure off of your body. So, and when you're pregnant too. So it's great for any time. I have them all over my sofas and nobody's pregnant here in the house, I promise that. But it doesn't matter. This can be used anytime. It's also made, one of the best features about the Back Buddy is that it's made with really all non-toxic foam too. So there's no chemicals in it. There's nothing bad that your little ones are going to be breathing in. And that's really important. A lot of people don't think about what is the product actually made with. And that was like a must. I know for Laura, it's a must to make sure that it has no toxic ingredients, completely chemical free, and CertiPure, which is a certification to really know that there is no chemicals in this. So if you would like to win the Back Buddy tonight, all you have to do is like or love this post, comment here, tell me sometime during the stream tonight why you love it, why you need it, how it will help you, and then register at the link that Joe put there. You probably all already did, but it's the regular Enter Me to Win link, and Joe will post it for you, okay? So that's the Back Buddy. We'll come back to it.
Awesome.
Roger, let's talk a little bit about what is chiropractic care in general, just in general, because I know people have, look, when I talk about chiropractic care, they think, well, I don't have back pain, so do I really need it?
Absolutely. So, many people think that chiropractors are for neck or back pain.
Mm-hmm.
But truly, what chiropractors are looking for is how well that intelligence from within is running. So when you were created by a higher power, right? I call it God. You had one organ in charge. It sits in your head. It's called your brain, right? Well, your brain has to send this intelligence, this wisdom, and this expression of life that runs right down your spinal cord and then out these nerves to every muscle of your being, right? Every movement that you make, right? Whether you walk, whether you're running, whether you're sitting, whether you're speaking, and the way that every organ of your being is functioning. So the way your heart is beating, where your lungs are breathing, where you're digesting food, where your reproductive organs are working, where that you're able to just have your moods beginning to, be in a happy state. All of that is occurring because your nervous system is sending that expression of life. Now, let's just use this as an example. If someone cut the nerve and it was running to your heart, what would happen, right, to you? Well, you wouldn't be alive, right? You'd die. And the opposite of death is life. So what's running through these nerves are life. And what we want to do is we want to make sure that this life is running at 100% to every vital organ of your being and every muscle of your being. So what chiropractors are doing is they're looking for the subluxations, right? Any misalignments or anything that's interfering with the communication from the brain down that spine, out to every vital organ or muscle you're being. And if there's any interference there, we want to remove it. So here's a simple example. If you take your arm out and you squeeze, right, and you squeeze your arm, and if you kept squeezing that arm, eventually what's going to happen to the fingers? They're going to go what, Shari?
Numb.
They're going to go numb, right? So we could keep masking the problems, right, and taking a potion or lotion, a medication, right? Or you can remove the pressure. And when you remove the pressure, you allow more of that God's life, more of that intelligence, more of that wisdom to begin to flow through the being and allow healing to begin to occur the way that you're designed to function and operate. And that's what chiropractors do. So they look for the interference, they remove it, and they allow more expression of life to happen.
And they do that by adjusting different parts of your body.
Exactly. So, we're making very gentle and safe type of adjustments on your spine, and by doing that, we're allowing more of that life to begin to send life to every vital organ and muscle you're being. So that's what we're doing. And there's many different techniques out there, right? And there's different tables that we utilize, and there's different instruments that we use, and that's how it is. And when it comes to children, there's specific techniques, that we do as well, and we can get into that as well.
Yeah, absolutely. Absolutely. And so let's start with pregnancy, because I know that the whole, we get so many aches and pains when we're pregnant. Everything's shifting. The hormones are going through our body, and, there's a softening that occurs. And so the hips start to,
with the relaxin, right?
Yeah. So I know that that's a time when a lot of moms really start to feel almost the need to see someone, because it's the first time that they're actually maybe feeling pain in their body. And they're not taking any kind of medicine, and it's a time when you really kind of rely on something like this.
Absolutely. Like, look, my wife is pregnant right now, right? So Christina is almost 25 weeks. So actually 25 weeks today. It's 25 weeks today. So
Awesome.
She's 25 weeks today, right? So so it's so beautiful, right? It's just so beautiful. And so she's going through the process, and you see every single mother's process is slightly different, right? So she was one of the lucky ones who didn't have any morning sickness, right? But so she's going through the process, and you start seeing her body beginning to shift, right? She's like, why are my hips all of a sudden feeling this way, and why is my low back feeling this way, or why am I getting some pressure up in here? Well, there's a lot of different hormones that are beginning to shift within, right? So as you begin to see that, what I begin to find is that, while that's happening, certain muscles are going into spasm. But what's controlling the muscles? The nerves that send the signals to the muscles. If the muscles now don't know how to contract and relax properly, that's because there's a misalignment happening in that spine. So I'll start seeing what's going on. All of a sudden her pelvis, we got pelvic unleveling happening. We have her sacrum beginning to shift. And as that begins to shift and the pelvis is misaligned, what do we got to do? We bring that back into balance. And as we do that, she'll get off the table and she'll be like, oh my God, I just don't know how anyone lives without a chiropractor. How is any woman living without it? And her pregnancy has been, look, I'm not the one carrying the baby, right? But she is. And
you caught yourself. That's awesome. That's the way to go.
I am not the one carrying this baby, and my wife is she's a blessing, and she's doing so amazing carrying our baby. But, she has been doing so great throughout this pregnancy. Her energy levels are good, right? Her body is doing so well. And the reason being, and I really believe it, is because of her chiropractic adjustments. And she'll say the same thing. It's because of my chiropractic adjustments. Or I have tons of patients who are pregnant right now, like many of them. And they go, Doc, and these are ones, many of them are ones who just came to us and haven't been with us throughout pregnancies, right? And they go, this pregnancy, this nurse who was a patient right now, she goes, this pregnancy is so much different for me because of the adjustments. I got energy, my body feels more relaxed. I'm having a better night's sleep. I'm able to sleep through the night. I'm not tossing and turning, feeling uncomfortable, right? All that sinus pressure that I was getting, which is common, right, when women are pregnant, or the headaches that they get, right, from the hormones, they're not happening. And you begin to see that. And I hear the same story with all the pregnancies, right? They're like, oh my God, my body's functioning better. I got more energy. I can move. And I can chase my other children around too. Exactly. I have the ability, because you got super moms.
Listen, we're having another one doesn't mean we slow down. So
exactly, you moms, I gotta just tell you, all you moms that are listening to this, you're all super moms, okay? And I know that this is why God has allowed women to carry babies, because us men, we couldn't do it, right? You are warriors, you're gladiators, you're so powerful.
I will agree with that.
Absolutely, and it's so vitally important for women to be under chiropractic care. Really is so important. And while they're under care, there's many different techniques, but we want to make sure that we have the proper tables as well that allow a drop piece so that the belly can rest nice and comfortably as well, right? So there's many different techniques that you would do, and we just really would have to find the right chiropractor for you in your area. And Shari, I'm happy to help these women that are all over the world begin to find the right chiropractor. And if they're in New Jersey, of course, I will, at the end, I'll if you listen to the end, I will make an offer that I'll bless every single one of them with.
Yeah, absolutely. Okay? That's awesome. And he's absolutely telling you, if you are looking for a chiropractor, you want to figure out how to find the right one, who to look for, you can message Dr. Roger and he will support you to find no matter where you are. Okay. And if you are in New Jersey, then you can go see him directly. And I highly recommend that. We had a couple people, I have a lot of people in New Jersey who follow. So I'm sure that they'll find you over there. I had a couple people post some questions. I'm going to put one of the questions. I'm going to actually read one of the questions right now. This came from Megan, and she said, "I'm pregnant with my fourth, and I have had pubic symphysis dysfunction with all of them. Could chiropractic care help with that? The pain is beyond excruciating, and nothing seems to help."
The answer is yes, absolutely, 100%. There are specific techniques that we would do with that. Okay, so we'd have to assess that in the office, right, and see why the pain is there. Right, so we'd have to see that. We have to see where there's interference in that nervous system, and then begin to remove it. And then we would check different joints as well, and make those specific adjustments and help. So absolutely, in our office, we are equipped to be able to do that, and I'd be happy if she's in New Jersey. I would be happy to. I don't
know where she's located.
Okay, and if not, we'll find her somebody who is, right.
What happens so often is that moms will go into their doctor's offices for their regular prenatal visits, and they'll complain of these type of pains or issues that they're having, and it's the worst thing to hear from your practitioner. "Oh, that's normal." And most of the time, that's what you're going to get is that answer like, "Oh, that's pregnancy. That's normal," which is like, AKA, just live with it. Just live with it. There's nothing we can do about that. And
you
what
don't
I
have
love
to.
about this and what you're talking about is that there is something that can be done. There is something that you can do to help yourself that's totally safe, that's totally like it works. And it's not only going to help, it's going to help impact your overall health altogether, not just the issue that you're feeling. There's all the stuff you're not feeling. And I learned that from you. When you feel pain, that's like the first time you seek it out, but that's not when you actually may be having the issue. It's way before.
That's right. Yeah, the body's been preparing for that moment, right? It's like when somebody says, "Oh, doc, I bent over and I threw out my back." Let's just use that because it's a simple one, right?
Right.
Well, no, it wasn't that moment when you bent over that you threw out your back that actually caused the problem. We got to look for what's causing it, right?
Right.
So whatever's been causing it is what we want to get to, and that's exactly what we would do, right? Because that problem's been building up for many years. It's the same exact thing. Like when somebody, all of a sudden had a heart attack. Well, hold on, this didn't just happen yesterday. The body's been preparing for that moment to occur. You've been, either creating physical stresses, chemical stresses, or emotional stresses, or a combination of all three for a long period of time before you got to a point where you developed heart disease, right? Or cancers or whatever it may be. The body's been building up to get to that point. It's the same exact thing with everything.
Totally. How does chiropractic care, how can it help to prepare mom for the birth process too? Because that's a great thing to get us started to help get ready.
Absolutely. Right. So are we talking about birth itself or when we are looking to get pregnant? I just want to have clarity on that.
Either one. I guess getting ready for the birth process starts with fertility and getting pregnant and then all the way through. But I know that you can do both, right?
Absolutely. So like if we were talking about, let's say, fertility, right? There have been many, and endless, right, who've had trouble with, conceiving a baby. And they've come to us and we run a specific test, right? We run a nervous system evaluation to see exactly how well all the nerves are running throughout the body. And we have a specific piece of equipment that's going to show me where we would have interference. We have mild interference, moderate interference, severe interference running to different areas of the body, right? Yeah. Then what we would do is we would take pictures of the spine. When we take pictures of the spine, we would measure them to exact degrees that they need to be at. See, most people don't know that, a spine needs to be measured at certain degrees.
Right.
and including many of your medical doctors.
Yeah.
They're not even aware. They know that, yeah, there should be a curve, but they don't realize that, okay, the first bone in the neck that protects the brainstem should be measured at a 31-degree angle. Well, we're going to measure that, right? And that the arc of life, that's sending that life from that brain all the way down that spinal cord out to those nerves, that should be measured at 42 degrees. And that we shouldn't have any forward head posture. That should be measured at 0 millimeters. Just using these as examples. And if those are off, well, that could begin to lead to the body not functioning at its optimal best. So we're going to measure those things, right? We're going to measure the entire spine, see what's going on. Is there any interference there? And then we can come together with a plan of action based on your goals and our findings. So just going to give you an example. My wife, Christina, right?
Who's in the chat room right now?
All right, who's in the chat room, right? Well, look, we've been wanting to have a baby, right? And Christina was dealing with, and honey, I know that you're okay with me sharing this, so I'm just going to say thank you for letting me share this, okay? But, she was dealing with a lot of polycystic ovary syndrome, right? So she had that. Then you check all of her blood work, and when you checked it, they said, listen, there's so much going on here, and because of everything that's happening, it's going to be very difficult for you to be able to conceive a baby naturally, right? Yeah. And you may have to go do the in vitro infertility type of approach. And if you do that, hey, we don't even know if it'll stick because of everything that's going on.
Hi. They're all saying it's frozen. 1 second. Okay, we're back. I see it's back. Nope, back. I don't know what happened there, but we froze for a minute. I actually told Dr. Roger to hold and don't speak because I wanted you to hear all this. So you didn't miss anything, okay? I don't know what happened. The internet, yes, we're back. Okay, go ahead. Now, proceed.
All right, I'm just trying to figure out where I ended. Okay.
Well, we were just talking about the
yeah. Okay.
Christina and her
Christina, right?
And
then we applied some, emotional release techniques and breathing techniques and some acupuncture to support as well. And what happened is within 1 year, we went back and got checked. And when she got checked, her polycystic ovary syndrome just happened to disappear. Right? Amazing. It was gone all of a sudden, miraculous, Amazing. Right? Yeah, but that's called innate intelligence. Just like, if you cut your skin, your body can form new skin, it clots and it forms new skin. That's an innate intelligence, right? It's the same exact thing. Your body can overcome anything in life without interference, right? If it's running stress-free. And all of a sudden we went away and we went on this little trip 2 weeks later and Christina got pregnant, right? Mm-hmm. So, and they were saying, she's not going to be able to get pregnant. So I got to tell you that there is hope out there. We call it hopium in our office, right? We give people hopium, and we see it all the time. I mean, all the time. It's endless amounts of women that I've seen get pregnant, right? So that's really part of the preparation, is really beginning to analyze, understand, detect, and then correct the subluxations. And when we begin to do that, the body begins to get healthier and well.
I know that so many people are sitting right now looking at the video, or if you're watching the replay, thinking that was not something that I understood or knew. And you think there's just nothing else you can do. And you guys are living proof, and so is that little baby in there, living proof that this really does work for that.
Absolutely.
So,
Absolutely.
Yeah. I want to also talk about the baby also, because that's like a big thing, being able to bring your baby, to have your children receive chiropractic care for things that I don't think people realize, like how well it works, I just want to remind anyone who's jumping on right now, if you are just jumping on, we are talking about chiropractic care for your pregnancy, for your baby, and we do have a fabulous prize from Back Buddy by Mom's Essentials, and that is the Back Buddy behind me here. And there's actually, I'm actually sitting right here with the Deluxe. This one actually zips off. So I don't know if you could see that, with a little pocket for your nipple cream maybe. But it washes, it zips off, and super comfortable. And now I just disrupted my whole, see, goes right back, because it puts me right back in the position that I need. There you go. Perfect. So if you want to win the Back Buddy, make sure you're liking, loving this post, and commenting here. We're going to talk about chiropractic care for your newborn and beyond.
Actually, let's talk about the newborn when the newborn is not even born yet, but is a
Oh,
fetus
yeah,
inside mommy's
absolutely.
belly, right? So when mommy is getting adjusted, because mommy's under a lot of stress, right, when she's carrying the baby. So when she's under all of this stress, carrying the baby and doing movements and maybe carrying another child,
Yeah.
in one arm and another one maybe on their pelvis and trying to lug around the house and taking kids to sports and all these other components, when mommy's under chiropractic care and her body begins to get less stressed, who else becomes less stressed? The fetus, the baby becomes less stressed,
Yeah.
right? So when mommy's less stressed, the baby's less stressed because the baby will feel and experience exactly what mommy is. So it's so important to be under that care and take care of you. I always say, mommy, put the oxygen mask on you first so that you could be enough to take care of everybody else,
Yeah.
right?
Yeah.
That's just like on the airplane. You get on an airplane, they put the oxygen mask on you so you can take care of everybody else. It's the same exact thing here. When mommy begins to take care of herself under the proper chiropractic care, then that baby's going to be less stressed and that delivery will be a lot easier.
Yeah.
That delivery will be a lot easier for mothers. That's another component. It's like, the mothers who are under chiropractic care, the delivery is just so much easier. And look, I'm not the one pushing the baby out, so I know it's not easy, women.
Easy.
I get it. It's not easy, but it's less challenging. Let's say that, right?
Yeah.
Because
Anything you can do to support yourself. And when you think
right.
about the whole process of labor and birth, it's such a physical process that your body's going through. So, of course, any kind of support that you can get to have the body function better, to have all the, like Dr. Roger said, the life force going through you better, to increase your flexibility, all the things that are going to make your body able to move into positions that will be more conducive for the birth,
Yeah.
is gonna help.
Yeah, it's going to help with the posture, right? So it's going to help you look better, feel better, and move better, right? And that's
Yeah.
what women want, right? They want to look beautiful, right? They want to
Now,
feel crazy, they
let's
want
move
to
on to
function
the
better.
baby because there's so much that we want to talk about when it
Okay.
comes to like the baby's born,
Yep.
and I know that you treat newborns like right there in the hospital or
Yep.
right after and
Yep.
beyond that too. I actually
Yep.
have a little video that you sent over that I could share with everybody, and I want to do that because it's so amazing to watch you do an adjustment on I mean, this is a newborn baby. This mom's right there in the hospital, right?
Yeah, and the father, and you could even hear, how their responses are, and
Let's,
yeah, just go ahead.
I'm gonna play it right now for everybody. Hold on one second.
Right.
Uncle Roger. Beautiful. You could just tell his whole eyes just went like,
Yeah.
you saw that?
Yeah. Yes. It's
Oh.
like relief.
Awesome.
Yeah, that was.
It's so gentle. Like it's like what somebody would imagine in their mind of what you're gonna do. And then it's like literally you're just supporting the baby.
Yeah, it's so what happens and what's common is, look, when a baby is being born, well, we know that moment, right, can be a little challenging for baby, right, and
Yeah.
mommy, right?
Yeah. Yeah.
Um, and what tends to happen is that when that baby is born,
Yeah.
well, look, what happens? They're pulling on the baby's necks, right,
Yeah.
to get them out, right? And
They're
as that
not
happens,
gentle with their babies are
no,
not
they're not.
handled gently. If you've ever seen a birth, you would know that it's not always there's a lot of manipulation that goes on often.
Yep, absolutely, right? And what happens is they'll begin to pull on the baby, and it's about 20 to 40 pounds of, torque and pressure that they're doing to get that baby out for you, right? But as they do that, is a baby's head stable at that age? No. And if it's not stable, well, what tends to happen over 80% of the time is that first bone in that neck, called the atlas, begins to get subluxated, right? And that's the area that protects our brainstem. And then what you tend to see happen in children is they'll end up developing things like auricular ear infections, right? Or acid reflux in time, right? Or allergies, or asthma, or ADD, ADHD, right? Or what you may call, and I'm just on the A's, right? I didn't get to, colicky or, immune system compromise and all those other components, right? But when you begin to see all of that, and that's why it's so important to have your child checked by a chiropractor who is very familiar with working on a pediatric level. And as you saw right there with that child, those are wellness members of mine, right? And they value taking care of their baby. So the second that baby was born, they wanted me there. And I checked that baby, and you saw when I made that adjustment, it was ounces of pressure, right? Specifically making an adjustment, just as if you had a tomato, right? And you were just checking to see how ripe it was, right? It's just that gentle, or how ripe is that tomato? That's the pressure that you're making an adjustment on an infant, on a newborn. Right. And when you make that specific gentle adjustment and move it in the right direction at the right time, that's why you saw that child right there. All of a sudden, take a big, deep breath in, right? You saw me. He took a breath in, right? Jackson just took a breath in and out, and all of a sudden you see his hands were moving and his face, and all of a sudden he just stopped. And that's why Daddy said he looks like he was relieved. Yeah. He looks so relieved. Yeah. And I see that over and over and over again. I can tell you a story about another.
I was going to say, there's so many reasons that babies can suffer trauma during birth. And you might be thinking, well, I don't think that my baby had any birth trauma. Birth trauma could come from long labors, short labors that are fast labors. Even fast, quick labors can cause trauma. You can have trauma from inductions, from Pitocin, from C-section, even a C-section, if you've had a long labor that failed to progress, that can cause some of the trauma that we're talking about. And then, of course, forceps deliveries, vacuum extractions, things like that. So if you've had any of these types of deliveries, and even if you don't think that you had any kind of trauma, depending on how the baby was delivered, who delivered the baby, and their technique and the way that the baby was twisted or pulled, something could be off.
And C-sections are even worse. They're really pulling and yanking, right? So there's so much out there. And look, my children were born midwife, doula, right? Mm-hmm. We're going to be doing a home birth. I know you have a segment on that next week, right?
Next week.
So so Christine and I were having a home birth, and it's going to be beautiful. But look, even with midwives and doulas, you're still pulling the same type of pressure, and I see it over and over and over again. It's so essential to have that baby checked. My daughter Sienna, when she was born, you would think that nothing, was off, right? It just seemed all beautiful and it was, it was just effortless, right? But when I checked Sienna, she had an atlas subluxation. Now you would never know. But when I made that adjustment on her, all of a sudden she took a big deep breath all the way in and all the way out. And as a dad, I melted, right? And as a doctor, I was like, thank God, thank goodness that I was right there to make that adjustment. Yeah. Or when you have a child who all of a sudden, I get a phone call from Daddy and he's like, can you get down to the hospital right now? Well, why? Because my baby, all of a sudden, the mother didn't have enough amniotic fluid, and my baby, all of a sudden the oxygen levels began to drop. And then the body temperature started to get cold, right? So now here they are, and they're ready to have an emergency situation where they're going to take this baby, put it in the NICU, right, and, poke and prod it and do whatever else that they do. But I got a call, and I got to that hospital. And when I got to that hospital, I checked that baby before it was ever going into that NICU. and I made that adjustment on that baby, and all of a sudden that baby's oxygen levels skyrocketed. The body temperature came back, and that baby did not go in that NICU. And of course, the hospital got a little upset about that, right? Because now they lost a ton of money. But that baby was in mommy's arms very shortly, breastfeeding, right?
Yeah.
Which I'm a huge advocate of breastfeeding, right?
Yeah.
I think it's essential, and I know that you're pro breastfeeding, and that's why I love you so much, right? I mean, that's just, we have a lot of the same values when it comes to that.
Mm-hmm.
And it's all about, doing things that are natural, and the way that you were really designed to function. That's why parents today are looking for that natural approach. Give me a better approach than, just, going to the medicine cabinet for every little component, right?
Exactly.
It's like, come on, we got to get away from that. That's not how our bodies were designed to function. We weren't lacking any of these medications. Every medication that we need already lives inside of us. So let's begin to take care of our families and our children naturally. And chiropractic is all about that. And chiropractic is really an art because it's working with the doctor from within inside of you. So the greatest doctor in the world is the doctor who lives inside of you. And what we're doing is removing the interference to allow the doctor from within inside of you to do the healing, the innate intelligence that you were blessed with, right? It's really a blessing that we were all created with that intelligence to be able to heal.
Well, and that's the thing is that we're so inundated with regular conventional medical things, especially when we're everything, and so being able to, and there is a place for medicine too.
Of course there is.
We're talking about the fact that there are other things that can be done besides just regular medical care.
That's right.
And chiropractic definitely, like you just described, like this baby that, needed something other than what it was getting. Hold on, my screen, I'm going back to my screen. I lost my screen. Okay, there you go. So it's a fantastic way to, let's talk for a minute about some of the other things that came up in the questions as far as what it can do to treat things like fussiness, reflux. You mentioned before ear infections and ear issues.
Absolutely.
So many kids are on tons of antibiotics, tubes in the ear. Tell me a little bit about that.
Okay. So, very, very important. And again, that happens so young, just like from what I was explaining, right? From the birthing process. Right. And then other than that, it's many times when they're babies, it's really from the birthing process, right? And we really have to check that cervical region, that neck. It's so vitally important. Ear infections, I mean, we've stopped so many children from getting tubes in their ears and helped many of them get the tubes pulled out of their ears, right? And we're always taking a look at that upper cervical. So C1, C2 region, those are the two areas that we absolutely must check out, assess, and then remove those interferences. What will happen is, especially with like ear infections, is all those muscles in that area will get really tight and spastic, and then all that fluid will begin to pool up in that ear, and it's got nowhere to really drain, right? So when that begins to happen, you'll start seeing bacteria growth happening, and then you'll see so many ear infections beginning to occur. And they don't just happen once, they keep happening. They reoccur.
And that's what happens is they reoccur, they're on rounds and rounds of antibiotics, which just then kills their whole gut and everything else.
Absolutely. It's destroying the microbiome, right? Their whole digestive tract. And then you got, you got the acid reflux. And again, all of these areas, everything I'm talking about really comes from that upper cervical area, but we will check the rest of the spine as well to see if there's any interference going on in other areas. Because if there is, those nerves are running to different areas. As we said, they're going to run to the stomach, right? They're going to run to the heart. They're going to run to the lungs. They're going to run to the digestive tract. We have to look and see exactly where there's interference and remove them. I'll give you a story about this. They weren't going to let this one baby leave the hospital because, if the child isn't going to the bathroom doing number two, right, pooping, they're not going to let it leave the hospital. So Mary Jo gave me a call, and I actually saw her and her baby today, and he's 2 years old, right, going to be going on 3 soon. And Mary Jo was coming to us because, she had some neurological challenges going on, like it's called MS, and she shared testimonials, and we helped her with that. And her body is thriving, right, and no medications, and just really just doing amazing. She's been a patient of mine for like 10 years. And so she's having a baby, and it was her dream to be able to have a baby and get married and all these things. And now she's at the point where she has this beautiful baby that's born. where she never thought. She was really like, is that even in my cards? Now she's at that hospital, and she had a midwife as well, right? And it was a beautiful birth. But now they won't let her leave the hospital because the baby isn't going to the bathroom. So she calls me up and she's like, can you get down to the hospital? They won't let me leave until this baby goes to the bathroom.
Mm-hmm.
And I said, listen, Mary Jo, I said, I'm going to come down there. I'm going to remove the interference, and we're going to see what happens. I go, but I said, I'm not going to tell you that baby is going to poop, right now, and you're going to get out of there.
Right.
I go down to the hospital,
Okay.
make this adjustment on her little baby boy, and next thing you see, the baby goes to the bathroom, and she ends up going home, right, which is
Awesome.
great. Or when you see a child who has had 4 brain surgeries by the age of 4, okay?
Wow. Yeah.
Right? A lot of fluid in the brain, right? A lot of fluid, right? And the head is enlarged, right? And all of a sudden, the family hears about us from another family member who had children who had allergies and had some attention deficit disorder that have gotten better under our care, doing exactly what I talked about, right? Let's look at what's going on in the upper cervical region. Really important for children. I can't stress that enough. And so those children got better, and then they sent them over, and we started checking out this little girl. And I said, listen, her immune system is compromised, right? Her growth and development is being affected. So we need to work on helping her immune system strengthen up. We have to work on helping her develop the way that she's supposed to and grow the way that she's supposed to. And then as we begin to remove this interference, then what we'll begin to see is that her development with her speech will come in, and her head will begin to, hopefully come back into the proper shape and size that we're looking for, and that fluid will be gone. And they said, do you really think that could happen? Do you really believe that could happen? And I say this, the greatest doctor in the world is the doctor that lives inside of you. The power that made the body has the ability to heal the body. If there's interference there, it makes no sense to leave it there, does it? No, we got to remove it. And this is what's been going on for all this time. And look how many, if we keep doing what we've been doing, we're going to keep getting the same results that we've been getting. And you've been under so much. Mom and dad aren't sleeping. Baby isn't sleeping. All of this is happening. We need to begin to look at what's going on. We remove this interference, and all of a sudden, this child's been under our care now for nearly 2 years. This kid's head is right back to where it needs to be. This child is smiling. It's playing with its siblings. It's speaking, right? And it's functioning so great. And when you see that, mommy and daddy are smiling now. They're so happy. Their lives are better. See, when one person in the family isn't doing well, it affects everybody, and especially when it's your own kid.
Absolutely.
For
sure.
So it's so vitally important. Then the other thing.
Somebody was asking, just a question, I know this comes up too because people get afraid for themselves, and then of course for their babies or their children.
Yeah.
Is it safe? Is it going to hurt? Like, does chiropractic care hurt? And that was something that I think Kate asked the question before, and she's been afraid to go because she has a fear of it's going to hurt her.
Well, there's so many techniques, and they're so gentle, okay? Mm-hmm. And they're all different techniques depending on, who we're dealing with. Are we dealing with a baby? Are we dealing with a toddler? Are we dealing with a teenager? It all depends on who we're dealing with. But at the same thing, is it safe? It's so safe that we have the lowest malpractice out of all doctors. Right? Mm-hmm. So, your average medical doctor's malpractice will be what, $30,000, $50,000, $60,000, $70,000. Mm-hmm. Chiropractor's malpractice insurance is $2,000 or below. Mm-hmm. So it has to be safe, right? In order for our malpractice to be so low. That's why when people say, oh my God, it can't be safe. I mean, well, right. Our malpractice is $2,000 or below. Well, that's saying something. Yeah. We have actually the safest techniques that are out there, and we can absolutely help. Well,
and does it hurt?
Well, that's a great question. So why are we in the situation that we're in is what I would ask. So are you hurting right now? Right? So if she's hurting right now, well, do we want to leave that pressure on there or take it off? So if there's a lot of spasticity in there, well, I may use an instrument to adjust at first, right? Mm-hmm. And it would be just so light, just like a tapping instrument, right? Mm-hmm. There are tables that drop so you don't feel any sort of pain or discomfort. Actually, most people come off the table going, Doc, I feel amazing. Yeah. Oh my God, why'd I wait so long to do this? Oh my God, I can't believe I can see clearly right now. Yeah. My energy is so good. Oh my God, I can I got to wake up like this every day. Can I come in here every single day? You know, you don't need to come in every day, right? But we will put together a corrective plan of action for you. So if she's in the area, I'll bless her with an exam, take a look at what's going on with her, and then
she's up in Canada, but she needs to find somebody.
I got plenty in Canada. I
Okay,
got some great doctors right in Canada, but based on their goals and the findings is going to be exactly the type of plan of action we're going to do, and they will walk her through exactly what needs to happen. It'll be very gentle, and then.
So let's for a second, if you are looking for someone to go to and you want a referral and find a good chiropractor who's going to be, and Dr. Roger is really the best. I mean, I have to say, I've been to different doctors and I love coming to you. And if he's got a referral that he's referring somebody, I would trust that opinion 100%. Can they reach out to you to find out where to go in their area?
Absolutely. Yeah.
The best way to do that, I think, is I tagged Dr. Rogers' Facebook page here in this post. So if you want to message him, you can go ahead and do that right to his page, and he will direct you in the right place. And then if you are in the New Jersey, New York area and want to come see him directly, you absolutely can. And I know he's got a special offer. Why don't you go ahead and tell them what they'll get if they want to come in to see you?
Great, no problem. But did you the link that you gave him on Facebook, was it the Above and Beyond Holistic Wellness Center page? All right, great, perfect. The offer that I'm going to bless everybody with is, typically to come in and have a full evaluation and examination costs hundreds and hundreds of dollars, right? But today what I'm going to do is I'm going to bless every single person who's listening to this, and their children and their families, a complimentary examination, right? As long as they book it over the next 2 weeks, okay? And they have to just let my team know that it's going to be promo code Shari, okay?
That's easy to remember.
All right, so if you're all listening to Shari.
Thank you for doing that.
Hey, listen, I was on Shari's show. Dr. Rogers said that he would bless me and my entire family, and we will. Okay. And
so
I'll bless
prizes for everyone. And if you want to just take a trip to New Jersey, you can come do that too. So
that's right.
But if you're not close, he will still help you. If you're not close, he will still help you find somebody.
That's right. And let me give him the phone number of the office. Is that okay?
Sure. And Joe can actually post it here too. So go ahead.
Okay, great. So the office phone number is 201-265-0555. That's 201-265-0555. Now, on Thursday and Friday, nobody's going to be answering the phones because we are away on a team building event that we're going to Arizona. We're leaving cold New Jersey and going to sunny Arizona, right, for a few days to do some team building stuff. And then I'm going to be speaking out in Arizona too to a bunch of doctors' offices. There's going to be about 150 there. So I'll be speaking as well over there. So it's going to be a really great time and well deserved for my team. So it's a great way to kick off 2000.
Awesome. You have a great team. You absolutely have a great team. I'm just looking to see if there was anything else that came in as questions, because I know there were a couple of other questions and I want to make sure. Somebody did ask, Rayanne, who's here in the chat, was asking about she's saying that they're working on her reflux. She's actually seeing a chiropractor. She's been to the chiropractor 3 times since birth. They're 7-week-old, working on reflux, and it really does work. That's all I've been reading in the chat. Everybody who's using chiropractic care for themselves, their babies, are just like raving about it. Like it really is working. It really is working.
Chiropractic care is so amazing. And again, whenever we go into talking about ailments, that's why I don't really like to talk about, ailments, right? And you always hear me keep referring back to certain areas because we're not chasing symptoms, right? What we're doing is removing interference and allowing the doctor from within to begin doing the healing. And that's what chiropractic focuses on. It's about allowing the doctor from within to do it. It's not about chasing symptoms, because when symptoms go away, does that mean we stop going? Yep. No, it's you got to keep taking care of your spine and your nervous system for a lifetime, just like you would with your teeth. Just like you take care of your skin, right? It's the same exact thing. So it's about taking care of your body and allowing that system that controls everything to be running well for a lifetime. That's why it's so important to be proactive when it comes to your health, not live a reactive life, which is what many people do. And then if you go to a chiropractor who also is trained in nutrition, right, and eating like we are, so we'll also aid and support the mothers on, hey, what's the right type of foods that I should be eating when I am carrying a baby, right? How do I lose some of this baby weight, other than the 500 calories I'm losing from breastfeeding, right? Like, what else can I be doing to get my body to run healthier, stronger, right? And, what kind of rhythms should I get into? What kind of habits should I break? And what type of exercises should I do, right? So I always say, if we get in the right rhythm, we break bad habits and we get into the right habits and we start exercising and moving in the right direction, we can get really healthy. And we got to remove the physical, chemical, and emotional stressors. And look, as moms, how many emotional stresses do we deal with, right? I mean, it's just restless night's sleep, right? Just that. Yeah. So there's just so much. And we'll teach breathing techniques. We'll teach affirmations as well, right? So it's
the whole body, and that's what I love about it.
It's the whole body. That's why it's a holistic wellness center, right? That's why we're called Above and Beyond Holistic Wellness Center, and it's for a reason.
Conchita's asking in the chat room here, does it help with reflux during pregnancy? So this is for her.
Yes, it does.
Yeah.
Absolutely.
Mm-hmm.
Absolutely.
Yeah.
Yep.
If you're having any kind of physical ailment, I would check in, because I think that we've mentioned so many things tonight that a lot of people didn't realize. Like, it's like that aha, like, oh, really? Like ear issues, like reflux, like this, all these, or infertility. Like, who would think that this is going to work? So if you're having any of these physical issues, remember, like Dr. Roger said, it's your body can heal itself. And this is how chiropractic care is that catalyst for that healing. And that's basically what they're doing and what we're talking about.
Yeah. And you want to get your body running healthy and strong prior to getting pregnant, and you want to keep your body running healthy and strong after you have that baby, right?
Yeah.
So you want to continuously do that. So if you want to keep getting stronger and healthier, right? I always tell people, all right, look, this is where you are now. Do you want to continue to get healthier and stronger? Mm-hmm. Or do you want to maintain where you are? Or do you want to go in a downward spiral? Everybody always goes, I want to get healthier and stronger. What do I need to do? Okay, well, tell me what your goals are, and I'm going to show you how to do that, right? And number one, we got to make sure we have more life running through the body, and then we'll focus on those other components as well.
Oh, someone's asking, I'm reading I can't help but read their questions here, about her husband has sleep apnea. Would it work for him for sleep apnea?
Well, sleep apnea, we got to take a look at what's going on, right? So we'd have to take a look at the cranium, right? See, do we have any cranial faults going on? Do we have subluxations going on in the cervical spine? Do we have a challenge of the nerves that are running down to the diaphragm, right? Do we have some digestive microbiome challenges going on? Is he carrying extra weight? Is he carrying that visceral fat, that spare tire, right? Yeah. So, these are different things that are going to begin to affect them, right? Yeah. And then you also want, there's also specific type of tools like that dentists also test as well to take a look at for sleep apnea as well. But in combination, I mean, we've seen many people, like my own father, who was having some sleep apnea type of challenges, who doesn't have them anymore. Right. So we've really taken a look at what's going on, and we begin to see, we do a lot of chiropractic neurology as well, where we want to balance left and right brain communication. So it's not just about adjusting everything, it's about creating balance within inside of the body. So there's specific adjustments that we're making, and if I want to upregulate more left brain activity, I may just adjust the right side of the cervical spine, the neck, and then I may put a scent underneath the left nostril, because that sense of smell is going to upregulate more of the left brain. I may pull on distal fingers on the left fingers to upregulate more left brain activity, because if I pulled on the right, I would activate the other side. So there's specific things that we're going to be doing in order to create balance within inside of the body. That's why it's applied chiropractic neurology type of techniques, and you're really able to help people get really healthy, strong, and well forever.
Awesome.
Love it.
Awesome.
I love
it.
I mean,
I want to just remind everybody a couple things. One is tonight's prize is the Back Buddy, one of my favorite things that is literally on every single show that I do, because it is my support while I support you. Love that, Laura. It supports me while I support you, and it can support you too. You can win one tonight by commenting here, liking, loving this post, and telling me why you need it. Someone's going to win, and if you don't win, and if you just want to have one right away, Joe's going to go ahead and post the link for Back Buddy so you can check out all the beautiful fabrics and colors and just the designs, so you can put one right into your home and use it right away. I also want to announce that our membership is open. And we haven't really done the big launch yet, but it is available for anyone to join us if you want to, okay? This is the My Baby Experts online community and school that I've been talking about for a very long time. We have all of my classes there. We have over 800 videos. This is episode number 133 of our show, and all the past episodes and the library is all there, including all the Q&As that I have done over the last 8 years with Jamie, by myself, with other guests. We have put everything into this library and a private Facebook group where you will spend time with everyone that's in there, all of our students, as well as myself. We're going to be doing some private Q&As. So Joe's going to go ahead and post the link. If you're interested in checking it out, it is mybabyexperts.com/aboutmbe, okay? And Joe will go ahead and post that in there so that you can all click over and check it out. And we also have our affiliate program that launched today. So if you want to refer your friends to the My Baby Experts community, to the classes, if you took any of my classes or you have done anything with me, whether it's the classes or the membership, and you want to refer a friend, you can make someone else happy, help them in their lives, and earn some cash too, because there's an affiliate program now. Woohoo! That's nice, right?
That's awesome.
That's
wow.
awesome.
Everybody
Awesome. You actually get 25% of anything that anybody buys. So.
Oh my God! Wow.
Yeah. Yeah. Joe, will you post that link? It's actually mybabyexperts.com/affiliate or affiliate program. I think all of them take you to the same page. All right.
I think anything that Shari does, everybody should just jump on board because she is definitely a leader in the industry, and I'm just blessed to call her a friend, family. She's just like a sister. She's just so amazing. I mean, look at that smile. She got such a beautiful smile, right? And yeah, you're awesome. And Joe's amazing. Your family's great. I love you. You know, you're so great. And Shari, you know, anybody that's looking, you know, let's say for nutritional support as well, like later on, especially like for like their children, you know, we do that as well, you know, and my wife is one of the nutritionists that helps specifically with children as well. So we have all of that kind of stuff down for anybody who's looking for that support. Even if they're from a distance, there's ways for us to do the nutritional component.
Awesome. Thank you so much.
Oh.
Wow. Our hour is up. Thank you for joining me, Roger. I've been waiting to have you on as a guest, and it was nothing short of miraculous as I expected. It was a wonderful night, better than even I could have anticipated. Thank you for all the great information. This show is going to be up for the next week in replay so that you guys can catch it. You can refer your friends. If you know somebody who could really benefit from this information, make sure you go ahead and share. We have so many people who watch this not live, but because they're just busy with their babies or they didn't know or whatever, they come back and they watch later. And again, if you want to join to watch the other 133 episodes plus the other 800 videos, come join me in my private membership group where you can see all of it, okay?
Awesome.
Thank you so much. Good night, everyone. And don't forget to watch next week. We have a really great episode next Wednesday night. We're back to our regular time, regular night, Wednesday at 9 p.m. Eastern. We are doing a fabulous show on home birth, okay? All about home birth. We have 2 midwives who do home births with us, plus we're going to be interviewing the filmmaker of a movie about home birth, and I've got the trailer and everything else for you. It's going to be a fantastic night. So excited. Can't wait to have you guys join us, all right? So watch for the announcements this week and the promos. Good night, Dr. Roger. Thank you.
Good night. Thank you.
Have a good trip. I'll talk to you
right.
soon.
You got it. Love you.
Bye, everyone. Love you too.
Bye-bye.